Okay, thank you. It's a pleasure to be here this morning and escape the febrile atmosphere of Westminster for a couple of hours. So I think when this symposium was advertised, I think Jeremy Swain was down to talk, and Jeremy is kind of my kind of sister colleague. He's the Deputy Director for Homelessness and Rough Sleeping Delivery. So Jeremy and I work very closely together. Today I'm going to step back a little bit from the angle of health and homelessness and present to you the government strategy for reducing homelessness and ending rough sleeping, before at the end of this presentation focusing a little bit on the commitments the Department for Health and Social Care have made in regard to reducing rough sleeping and how we are working with them. So to begin with some of the data which John has already briefly outlined. In terms of trends in wider homelessness, we've seen year-on-year increases in the number of households in temporary accommodation for the last 8 years. So there are now over 80,000 households. That equates to about 200,000 individuals, adults and children. What we haven't got, well, I haven't put up there, which John mentioned, are the different types of temporary accommodation, and they do vary quite widely from bed and breakfast to quite sustainable long-term accommodation in the private rented sector. I don't think I need to explain to this audience the negative impacts of living in temporary accommodation, particularly in terms of the life chances or educational and health outcomes, particularly for children. In terms of focusing on the kind of most extreme end of homelessness and rough sleeping, I should say actually this, I don't know quite how my team managed to put such a large y-axis on this. Isn't attempting to downplay the increases that we've seen in rough sleeping, but we have seen since the new methodology was introduced in 2010, year-on-year significant increases, and we managed to reverse that in the last year a little bit, and I will go on to explain why I think that has happened and where I think the trend has, where the trend will go. In terms of how local authorities count the number of rough sleepers, this is a challenging thing to do. Homeless Link have some pretty clear guidance in terms of estimating the number of rough sleepers or actually going out and doing accounts in their area. And so they are the kind of the guardians of the methodology and ensuring that the count is legitimate. And so I am fairly confident on the numbers that we have seen in overall fall in the last year. So what is the government strategy? It starts clearly with building more houses, and if James Brokenshire, my Secretary of State, was here, he would say that all types of governments over the last 20, 30 years have not built enough houses, and that's why we have the housing market crisis that we do, and that this government is committed to building the houses that we need and significantly increasing supply. Two of the policies that I'll just outline on this slide include a further £2 billion for housing associations and local councils to deliver more affordable homes, including at social rent for the first time in a very long time. And last year, a kind of technical announcement to lift the housing revenue account borrowing cap to enable councils to borrow more money to build more council homes. And so, John mentioned the kind of quite shocking statistic about Scotland building more council homes last year than England. I think this government, and certainly my Secretary of State, is committed to changing that, and hopefully we will see a lot more social housing being built in the medium term. So turning from the building of houses to the homelessness and rough sleeping. So our rough sleeping strategy sits on the implementation of the Homelessness Reduction Act, and that is kind of absolutely essential, and John mentioned kind of the role that Crisis played in lobbying to bring that in. I don't think I need to go into too much detail on the new duties that the Act brings into this audience, but we are seeing a lot more people getting support from housing officers in local authorities trying to prevent their homelessness before they actually become homeless. We have a team of expert advisors who've been seconded in from the sector who are going around and account managing local authorities and trying to support them in implementing the Act, and where they need to, being a kind of a critical friend, and where we think that performance is not good enough. And we've also provided substantial amounts of funding to enable local authorities to implement the Act properly. John mentioned already the duty to refer that is on quite a lot of public agencies, so they have to refer someone who is at risk of homelessness or who is homeless to that housing authority so that they can support that individual. That came in October last year, and we have seen lots and lots of referrals from public agencies, so the process is beginning to work. In terms of the impact of the Homelessness Reduction Act, the eagle-eyed of you would have seen on the first slide that although we introduced the Act last year, we've still seen an increase in the number of households in temporary accommodation over the last year. I think it is too early to kind of properly analyse the impacts of the Act so far, but in terms of what the overall impact will be on the numbers in temporary accommodation. But we, as I have said, have seen a lot more people being supported, and in some local authorities, we are seeing a lot more single people being placed into temporary accommodation who might not have been before the Act was introduced. And so that is actually, in the short term, quite potentially a positive outcome for that group. They are being placed into housing, whereas previously they would have either been left in very unstable housing, whether it be sofa surfing or potentially even at risk of being on the streets. We also have a commitment to review the Homelessness Reduction Act, so we're reviewing all homelessness legislation. We'll be we have a statutory duty to place a report in front of Parliament by March 2020. So we're reviewing the legislation, whether we think it goes far enough. We're also reviewing the kind of operation of it and whether the burdens being placed on agencies and local authorities are right, how the processes are working. And that review will be kicking off shortly, and we'll be launching a consultation on some of those elements shortly. So moving on to rough sleeping, we've had in 2018 a two-pronged strategy to tackle this problem. So in March last year, given the kind of crisis that we were seeing on the streets, the government launched the Rough Sleeping Initiative, which is based largely on the kind of methodology that Louise Casey used in the rough sleeping units. So we've brought together a multidisciplinary team. Jeremy Swain has been seconded in from Thamesreach to lead that team. We have experts in rough sleeping. We have two health specialist advisors in there. We have a probation specialist advisor. We have a welfare specialist advisor, immigration advisor in there. We have provided £30 million worth of funding to 83 local authorities who have the highest numbers of rough sleepers. Our specialist advisors have worked with those local authorities to co-produce plans bespoke to that local area about how they can reduce rough sleeping in that area. Some of the interventions that they have introduced include rough sleeping coordinators, just to give a bit of strategic oversight in that area and drive forward the work. Lots more outreach workers, emergency accommodation, shelters. Around £4 million worth of that 30 million has been spent on health interventions, including more mental health nurses and the like. We've also spent £5 million on some emergency cold weather accommodation over the winter that we have just had. As John said, in those 83 areas we saw a 19% fall in the number of rough sleepers, and considering the kind of short time frame, that was, I think, quite an impressive impact. So the Rough Sleeping Initiative was launched in March. We allocated the funding in July. Services got up and running in August. The count that we measure ourselves on was in November. So within 4 months, we saw about a 19% fall. We have £45 million in 2019-20 to continue the work of the Rough Sleeping Initiative, and I am confident that will have a significant impact in driving down the numbers of rough sleepers in those areas. I should say that of the 45 million, 34 million being allocated to those 83 areas that we gave money to this year, and 11 million will be allocated to kind of additional local authority areas. So we are spreading some of that work. So that was the Rough Sleeping Initiative, was our kind of immediate emergency crisis response, which I think was absolutely necessary. Last August, my team published a cross-government rough sleeping strategy, and so for the first time in a long time, the government set out its vision for halving rough sleeping in 2022 and ending it in 2027. We were supported by an expert advisory panel, of which John sat on, and they gave us a large number of recommendations, and we were able to take some of them forward. And it was overseen, and this might be quite technical, but it was overseen by a ministerial task force chaired by David Lidington on behalf of the Prime Minister. And we had 6 Secretaries of State from the key departments kind of driving forward the strategy. We had a £100 million package over this financial year and the next financial year, and it's based on the 3 key pillars of prevention, intervention and recovery that are outlined there. I want to focus in particular on the main element of the strategy is that we want to see a rapid rehousing approach to tackling rough sleeping. We want every local authority to have an effective pathway where someone who is at risk of rough sleeping or who has quickly gone onto the streets, they are quickly assessed in a safe environment. They are then moved very quickly to the appropriate permanent accommodation with the support that they need to sustain that accommodation wrapped around them. And 4 of the key policies announced in the strategy where we're helping to move towards that outlined on that slide. So a somewhere safe to stay hub, which is an idea that came from our expert advisory panel, and that is a kind of a rapid assessment centre. We have 5 of these up and running at the moment. We'll hope to have 11 up and running by the end of next month and over 15 next year. Funding for local lettings agency and supported lettings, which should hopefully improve access to the private rented sector and provide floating tenancy sustainment support for these individuals. And then running alongside that, navigators whose role is to support those individuals to access, work with the public agencies and access the support they need. So it might be taking them down to their Job Centre Plus interview, making sure they attend the health service that they need to attend. If there's any probation or immigration issues, helping them tackle that. In terms of this rapid rehousing approach, for the most vulnerable, housing first will be the most appropriate route to support those individuals. And we have 3 large-scale pilots in the Manchester, Birmingham and Liverpool areas that are running at the moment, and we have the first people being supported in housing in Walsall. The government is supportive of housing first, and this large-scale trial of about 1,000 individuals is properly testing the model in a British housing and welfare situation. So far, I've just mentioned Ministry for Housing policies in the strategy. The government is quite clear that this is not just a Ministry for Housing responsibility, but indeed all departments need to play their part in helping achieve the government's aim of ending rough sleeping. We have in our rough sleeping strategy numerous commitments from other departments. Just to alight on a couple here, we're working with the Ministry of Justice on 3 pilots in Pentonville, Leeds and Bristol prison to ensure that offenders on short sentences, when they come out of those prisons, are being placed into secure, sustainable accommodation and have the support they need to sustain those tenancies, so that they don't eventually end up on the streets or end up back in prison. The Department for Education has put additional funding in place for more support workers for those care leavers who are most vulnerable in terms of leaving the care system and ending up on the streets or becoming homeless. The one department I haven't got up there is the Department for Health and Social Care, which I will turn to shortly. I had produced a slide on health and homelessness, but given what we've just heard, these figures seem kind of a bit glib. I will just say that we have introduced a new homelessness data system, which for the first time records the support needs of individuals who are presenting as homeless to local authorities. There's about 21 different categories of support needs that we record. We introduced that last year, and some of the data there shows that the health support needs are by far and away the biggest category of support needs for people presenting as homeless, and that obviously becomes much worse for people who are sleeping rough. So what is the government's ambition for health and homelessness? At a strategic level, there is integration between the departments, between the Ministry for Housing and the Department for Health and Social Care. So I have a secondee in from the Department for Health who works for me. Jeremy has 2 expert advisors whose background is in the health world, and we have some quite clear ambitions. We want to ensure that ill health does not contribute to someone becoming homeless or sleeping rough, that homelessness or rough sleeping does not prevent them from accessing health services, and that ill health doesn't prevent people moving on from homelessness. Now, I would say from a Ministry for Housing perspective, the best way that we can do that is to move people into accommodation and sustainable accommodation as quickly as possible, because access to health services becomes much easier when that is done. So that is kind of our main priority. In terms of our health advisors and experts, I talked about what they are doing. So they are supporting the delivery of our commitments in the rough sleeping strategy, which I will just come on to. They are also working in our rough sleeping initiative areas to facilitate better partnerships and relationships between the local authorities and the health bodies in those areas. So they're also on the ground trying to facilitate that better integration. So in terms of the key commitments that the Department for Health and Social Care made in the rough sleeping strategy, in which they are taking forward, we are conducting a rapid audit of health services in our 83 rough sleeping initiative areas, and we've worked with an expert panel of health and rough sleeping experts to provide an audit tool to those 83 local authorities so they can assess the quality and provision of health services to rough sleepers in those areas. The Department for Health is providing £2 million this year to test different service models to see what is kind of best practice, and that audit and these £2 million pilots or trials will inform the commissioning model for the £30 million commitment that NHS England made in the long-term plan to provide additional mental health services over the next 5 years. And I'm sure when the Director for NHS England presents tomorrow, you'll be able to ask him a lot more about the detail of that. Finally, I just want to focus on supporting on safeguarding adult reviews, which has become a kind of hot topic given all the ONS data and the Bureau for Investigative Journalism on deaths of rough sleepers. We made a commitment in the strategy that under the current legislation, we would try to ensure that safeguarding adult reviews are carried out where the threshold is met for rough sleeper when people die on the streets. We're doing some work with the local government association and with health and wellbeing boards to ensure that those reviews are being carried out where the threshold is met. We've asked the King's College London to conduct a thematic review of the National Safeguarding Adult Review Library to ensure that that best practice of those reviews and that knowledge is shared. Where the Department for Health is also doing some early work and thinking on where the threshold isn't met for a safeguarding adult review, how else can we ensure that lessons are being learnt? And while that these reviews are important and critical, our general strategy is to move to a much more preventative approach where these preventable deaths are not occurring, and that is kind of what our focus is on. Just for completeness, I've added in all of the recommendations on this slide and some of the kind of more minor commitments that Department for Health and Social Care is making, and they are kind of important things on improving guidance and data capturing systems. But I won't spend too much time on those today. And then finally, I thought I'd just set out some of the kind of key policy challenges as I see them. While we saw a kind of welcome change in the number of rough people sleeping rough over the last year, we saw actually quite a significant increase in the number of non-UK nationals sleeping rough on the streets, particularly Central and Eastern Europeans in London. This is a very challenging policy problem given the way that existing welfare, housing and immigration policy all interconnect with each other, and we're working in particular quite closely with the Home Office to try and ensure that we can better support those individuals off the streets. We want to move to a particular focus on what we are calling safety on the street. So this is not just about accessing health services, but how can we tackle the exploitation that goes on and the risk of abuse and neglect that currently we kind of know is happening on the street at the moment. And so that's kind of a strand of work that we want to take forward this year. And finally, all of our funding, as all government funding, is kind of announced until the end of March next year. So I'll be quite interested to listen to the Chancellor a bit later this afternoon to see, first of all, how the public finances are looking as we go into the spending review later this year, and also the assumptions that the Treasury has provided to the Office for Budget Responsibility in terms of government departmental spending levels as well. So a big focus of my team will be to ensure that we have a successful spending review later this year so that we get the funding that we need to continue to deliver some of the interventions that we are rolling out.
Thank you very much indeed.